It can be extremely intimidating for patients, family members, caregivers, or advocates to sit at a table with world-renowned experts, people at the top of their game, researchers that have been working in this area for many decades. So some of the things that we do are actually have staff calls with our patient advocates and let them know what the guideline process is about. We make sure that we have more than one patient on the panel. We don't want them to feel like they are isolated and that they have to represent all of the views. Beyond the phone calls that we have with the staff and the opportunities for them to tell their stories, if we do have in-person meetings for these panels, we often give the patients time on the agenda to introduce themselves to the entire panel and give kind of a brief bio, not their entire medical history, but work with them to almost develop their elevator pitch of, how they or their loved one is affected by the disease, what they are hoping to bring to this development effort. We need chairs to have individual conversations with the patients, consumers, advocates that are on the panel. The chair needs to make space in the meetings, whether they're on the conference call or whether they are at the in-person meetings, to ask the consumers to speak up. Ask if they understand the discussion, if they have something to contribute to the conversation. They shouldn't be overlooked at the table. They really need to provide that perspective. There's a reason that we have them on the panel. Patients are part of the voting process. So they are at the panel table once the evidence has been discussed. We have a clicker system where patients can vote on approving or not approving the recommendation, or depending on whether it's a yes-no vote or kind of a Likert scale, where they strongly believe, they somewhat believe the evidence, or allowing their patient preferences into the panel. Consumers United for Evidence has been a great allied partner with us as we have sought to develop some of these guidelines. CUE really provides great training videos. They vet a lot of their participants that come on to the organization and really work with us, with the Academy of Neurology, to place individuals that can really provide that perspective that we're looking for. When patients come in with that knowledge, that really elevates their perspective. It elevates how they are regarded on the panels. And the Guidelines International Network has the GIN Public Toolkit, which gives some great guidance and overview of how patients can be involved and how physicians and how guideline developers can incorporate them and make them feel really welcome as part of the team.